to the mystery hours for Safe and Sober. So happy you have joined us. I did not update the description. I apologize. I think we're going to fix that. It is not segment 2. It is segment 3. We're going to be interviewing Amy Hill with Burrell to get more of an insight into the mental health issues and talk about how Safe and Sober, in their continual adaptation through the years, has said, let's get down to the core issues, the mental health issues, the reason why kids feel they need to cope with these substances and stuff that's no good. What's a better way? So we're going to get into that with Amy Hill. We got a great, it's going to be good. If you're just joining us, we're doing this. Started at 10, 11, noon, 1, 2, 3. And we are doing 10 to 15 minute segments or so you can learn some more about Safe and Sober. Also, it is a fundraiser. And we have our hour 3 update. Yeah, I'm excited. I know you are. So here we go. I need to get a drum roll. I don't have a drum roll. That's okay. Here we go. Here it is. 9,400. 9,400. Thank you so much. Our goal is 30,000, and we are on our way. That's amazing. Thank you all so very much. What a big day this is to, there's the thermometer, to help teenagers in our communities. And by our communities, I now mean 10 states, nearly 600 schools. We're going to hear next hour from teachers about how useful it is for them in their schools. We're still focusing on mental health to start. Why is there this need for Safe and Sober, and how to best effectively go after it? As always, we are sponsored by those guys, Cox Health. You know them, you love them. And Safe and Sober, there's that logo. We're sponsored by Safe and Sober. Safe and Sober is sponsored by Safe and Sober. I would be remiss if I did not remind you that there is an auction going on, a very good auction going on right now. We're going to put the link out for you guys. Go to that auction. Everything benefits Safe and Sober, which is what we all want to do. Also, there's cool stuff. A Mexican getaway, a Hamilton experience. We also have signed ticket collages, Kansas City Chiefs, also Kobe Bryant collage. It's all very, very cool. Get over there. Do it. Do it. Do it. We know how the internet works. Everyone's on calls, on Zoom calls all the time. We know that you're doing one thing and something else at the same time. It's okay. We acknowledge it. It's fine. Okay, what else do I want to say about that? This hour is brought to you by Burrell Behavioral Health. How about that? And we'll hear from Amy. There we go. That's what we're going to do, and we're going to show a video, and we'll be in and out in 10 or 15 minutes or so. There is an auction link now in the comments. Look at the comments. Click on that. It's good stuff. Good stuff. No, get out of there. Remove. So there you go. You guys are making a huge difference. We're already at $9,400. So let's learn some more, deepen our knowledge for why Safe and Sober is important. An interview with Amy Hill from Burrell. Let's get to it. Let's get to it. Let's get to it. Let's get to it. Amy, thanks for joining us.
Thank you so much for having me.
Yeah, so let's start out with, mentioned you're at Burrell, but what do you do in particular there?
Yeah, so I am the system director for school-based services for all of Burrell Behavioral Health Systems. So we are in our 3rd year now of this new department. I say new, I don't know if it's new anymore since it's been 3 years, but it's a newer department at Burrell. We're in our 3rd school year, and we have 17 counties in Missouri that we're the community mental health center for. So we partner with about 50 school districts in the state of Missouri, and then we have multiple districts down in our 8-county area in Arkansas. And so my job really is just to oversee the day-to-day operations of our school-based department. I am a therapist, and I have been for about 15 years. And I've spent almost all of that time working in school mental health. And so now I don't do a lot of direct care anymore, but I get to oversee just our operations. We've got over 3,000 kids enrolled in school mental health right now at Burrell.
Yeah. So I mean, obviously, what you guys get to witness is the need for it. And many of us maybe remember school,
Mhm.
or have this like kind of vague understanding, but what do you guys see in terms of the need for mental health care for teenagers?
Yeah, sure. So what we know, if you look at national data, it's the same with Missouri and in every area, about 20%. So 1 in 5, some research even indicates maybe 1 in 4 kids, youth really do struggle with a diagnosable mental illness. And so we oftentimes think that, oh, kids are just being kids. But the truth is there's a good chunk of our kids right now who are really struggling with whether it be anxiety or depression or even some behavioral issues. And so what we know about school mental health and why that's important is oftentimes I think people think we're treating school related issues. We aren't. We're treating mental health issues, just using the school for the setting to do so. We know that 80% of all kids who ever receive a mental health intervention in their life will do so in a school setting. And so it's oftentimes hard for parents to maybe not even identify or recognize that their kid is struggling, but if they do, really just struggle with how am I going to get my kid to therapy? And so we bring those services to the kids just to open up access and be able to treat that mental illness.
Yeah. And I mean, that's fascinating. Just go to, I mean, so simple, I guess. I mean, it's kind
Yeah.
of, you guys
Mhm.
made it uncomplicated. Go to where they are and meet
Yep.
them there. Are mental health struggles somehow different for teenagers now than like when I was in high school?
Sure. Oh, sure. Somebody recently asked me, what is the biggest mental health struggle our teenagers are facing right now? And I really would want to answer that with mental health is the biggest struggle our teenagers are facing with mental health right now. There's a list a mile long of things that are struggling with. There was a recent Pew survey that came out that said last year that came out that said mental health was the top concern among teens, and only 4 or 5% of teenagers didn't identify mental health as an issue. So we certainly have a lot of different struggles that our kids are facing now. Certainly reputation management is a huge one with social media. I think we can point the finger back to social media if we want to and find reasons why that has really been difficult and just an extra pressure for teenagers. Also understanding there's some good things that come from social media, but we've got issues with isolation, social isolation, all kinds of things that teenagers are struggling with. And when you add COVID, that just adds a whole nother component. So I think certainly kids are experiencing mental health struggles in a way that you and I didn't when we were growing up as teenagers. However, I also think we're starting to identify them better. We're starting to recognize that this isn't just a kid who doesn't want to do anything. This isn't just a lazy kid. Kids can
Hmm.
get labeled as lazy or defiant, or they just don't care, or they have bad parents, or whatever it might be. I think we're getting better. In today's day and age, it's stepping back and saying, maybe there is more than just this kid is lazy. Maybe there's some depression or there's some anxiety there. So I think it's kind of twofold. Certainly we're experiencing different kinds of stressors, but we're getting better at identifying it also.
Yeah. Okay. So then kind of relating that to, excuse me, safe and sober. Safe and sober has historically
Yeah.
been underage drinking and prevention and substance abuse prevention. How does mental health for teenagers play into that?
The issues with sobriety.
Yeah.
That's a great question. And again, if you look at national trends, we're making some progress with teenagers with substance abuse. We really are. And I think a lot of that is because of things like Safe and Sober, right? We've got a lot of programs that we're bringing into the schools and that it's working. We're seeing that kids are starting to learn more about substance abuse and steer away from that. But what we also know is that mental health is significant. It's so important to kids that if they don't have their mental health needs met, they're going to go looking for artificial attachments, right? So if we don't find ways that we can feel significant or we can feel safe, or we feel like we can flourish in our environments, our brains are going to look for a way to meet that need. And they're going to look towards artificial attachments. And oftentimes drugs and alcohol are an artificial attachment. They use that for a way to fit in, or a way to cope with however they're feeling, or just to meet a need that they're not getting. So they're super connected, very important together. You know, I will oftentimes say, show me a teenager with drug and alcohol issues, and I'll show you a teenager who needs some mental health support. You know, we can't separate the two.
Yeah. So it seems like it's strategic that there's the issue of substance abuse or underage drinking, but below that's the root of mental health. And if you can go down to what the root is, then you can take care of a lot of things as a result.
Yeah. Or teach even other ways of coping, or looking for helping them find the right attachments that they need, that they're not seeking out something like drugs and alcohol, for sure.
Yeah. So how do you recommend parents, obviously this is a concern, but maybe they weren't brought up on talking about mental health. They don't know how to like have that conversation. How do you recommend having that conversation with your?
Sure. Yeah. I mean, I would just start at the dinner table conversation. You know, go back to these ideas of having some dinner table conversations with our kids and talking with them about how they're feeling and what's going on in their world. I think we have to normalize mental health so much more for our kids. You know, we tend to separate physical health from mental health. We wouldn't be hesitant to talk to our kiddo about, hey, are you running a fever? Or are you sick to your stomach? What's going on? But what we need to understand is that the body is one. Our head cannot separate itself from the rest of our body. And so we need to treat our mental health issues just like we would physical health. They're the same. They're just as important, and we are in one body. So I would start by just asking kids open-ended questions. You know, if you say, hey, do you have a good day? Your response is going to be yes or no, or it was fine. But ask some open-ended conversations about how they're feeling, what's important to them, what are some things that they would like to see different. And I think also normalizing for their children how they feel and the things that they experience, making this a more common conversation, and then being willing to hear what they have to say. It's amazing what kids will tell you and will share with you if you'll just ask them, and if they just feel like they're heard and they're validated. And then don't be hesitant to seek out some mental health support, some professional help with this. You would certainly take your kid to the doctor if they had a fever for 3 or 4 days, right? You're not just going to leave your kid laying on the couch at home for week after week after week and never address their physical symptoms. It's the same thing with mental health. If it looks like it's an extended problem, it's not just something that's going to go away in 2 or 3 days, seek out that mental health support for your kiddo.
Yeah, that's great advice, and so connected to the mission of Safe and Sober. So Thank you, Amy. Thanks for what you do. And I know Safe and Sober appreciates the connection with Burrell and just the digging down to the mental health issues at the core of things. So thanks for joining us today.
Thank you so much for having me.
Yeah, I enjoyed that. Really insightful stuff. Mental health's the root of a lot of things, right? Let's get a handle on it. I have an appointment at Burrell tomorrow. How about that? Love them. Love what they do. Love the focus on mental health that Safe and Sober has really committed to. So let's look at a trailer of kind of what they're doing. As I said, we've really been talking about mental health and talking about how adaptable Safe and Sober is to try to be as effective as possible. And here's a video explaining just that.
We know the average person tries alcohol for the first time at age 12. We know that the human brain is not fully developed until age 25. And we know that students who drink do worse in school and are more likely to abuse other substances and participate in other dangerous behaviors. For over 15 years, Safe and Sober has been on a mission to prevent young adults from using and abusing these substances. This has saved lives and spared countless families the heartbreak of addiction and preventable tragic events. And for the majority of these 15 years, we've focused on preventing the act of substance abuse. Now, it's time to address a major underlying cause behind these actions. We are in the middle of a mental health crisis in the United States, and teenagers are not exempt. 1 in 4 experience general anxiety. Over 1 in 20 have a severe anxiety disorder. Many struggle with low self-esteem, depression, and even suicidal thoughts. The truth is, many of these young people aren't drinking and abusing substances only because of peer pressure. Many are turning to these substances in order to cope with stress, and this is profoundly dangerous. That's why we're developing new material designed to help young people understand and improve their mental health, to teach them healthy coping mechanisms, and to give them a better, more sustainable solution to their problems that doesn't involve turning to dangerous substances like drugs and alcohol. It's time to address the mental health crisis plaguing our students and young adults, and we need your help. Your financial support can help us bring these important programs to students across the country. Learn more at safeandsober.org.
Important work, right? Important. And I love how, and I can't remember who we spoke about this with, but how Safe and Sober has changed from don't do these things to don't do these things and let's work on the things so you can have better choices. It's really great. Okay, so at 1, we're going to keep this thing rolling. We're going to hear from educators who have used Safe and Sober in their classrooms. And you get to keep supporting Safe and Sober. We have a donation link at the top of our page. We also put it in the comments. So go ahead and donate. Let's see what we can get by 1 o'clock. And then also go to the auction. And that's where you get to donate and get something. So either way, it's great. So we'll see you real soon at 1 o'clock, where we get to hear from educators. Thanks so much for joining us today. And thanks for supporting Safe and Sober. See you soon.